Hello, everyone, and welcome to Care New England Talks Health, a free webisode that brings together a panel of experts from the Care New England healthcare system to answer all of your questions on breast cancer. Now, I'm Tara Granahan, anchor and producer of the WPRO Morning News. I'll be moderating tonight's presentation with this fine panel of folks. You should know that Care New England was founded in 1996 by members committed to the vision of building a better system of health care for people and communities all over southeastern New England. And it consists of Butler, Kent, Women and Infants, the VNA of Care New England, and also the Care New England Wellness Center. Now, this integrated health system is reinventing the way that health care is delivered, combining a broad spectrum of care under one umbrella, so it's very easily accessible to patients and their families. Today's webisode is an example of bringing care and health care information to the public. CNE Talks Health tonight focuses on breast cancer, and we've assembled a multidisciplinary panel to answer all of your questions. This is going to be a fantastic event. Our Care New England experts right here, their titles: Dr. Angelis DeRobertis. She's a radiation oncologist at Kent Hospital. Put a little hand up for the doctor. She is an expert on the use of radiation as treatment for breast cancer, as well as its side effects. Also, Dr. Michael Fiore, a psychiatrist at Butler Hospital and head of its adult outpatient psychiatric consultation services. And he can answer all your questions about how the diagnosis and treatment of breast cancer can affect patients emotionally and the type of treatments available. Dr. Jennifer Goss, surgeon-in-chief at Women and Infants, who performs oncoplastic surgery, which enables her to remove cancerous tissue from a woman's breast while reshaping the breast with plastic surgery techniques. Also, Dr. Robert Lagari, director of the Breast Health Center at Women and Infants, a hematologist and oncologist with special expertise in breast cancer genetics. We also have Nancy Roberts, president and CEO of the VNA of Care New England, and she talks about home care for cancer patients, and Kathy Shilko, a nutritionist at the Care New England Wellness Center, who can answer questions about the importance of good nutrition for people undergoing cancer treatment. Hopefully I said everyone's name correctly. All right, we're off and running. Tonight's event features a studio audience as well as people watching this stream live on their computer. So we have all kinds of folks listening in and paying attention to some very important information. Now, several questions were submitted ahead of time. So we're also hosting a live chat room throughout this webisode. So you can submit your questions for our panel through the chat room, and hopefully we can get to all of them. So now we're going to get started with those folks that had very important questions that they want the answers to, and they've already submitted them. So are we ready, panel? You look like you're raring to go. Here we go. You're used to this, so you're going to explain it to us the way we need to hear it. Okay, our first question comes from Michelle from Cranston, and she is asking, both my mother and grandmother have had breast cancer. I am now in my mid-40s with no problems. Now this is going to go to Dr. Lagari. She says she has no problems in her mid-40s. Will I definitely have breast cancer at some point? Dr. Lagari, can you answer that question for her?
Sure. That was Michelle?
Michelle.
So Michelle, your risk for breast cancer is increased at least a little bit because you've got a first-degree relative and a second-degree relative who have developed breast cancer, but it doesn't mean that you'll definitely develop breast cancer. So it's something to be aware of, something that you should discuss with your physician. And then, one other option would be to consider some genetic counseling. That's an opportunity to sit with someone who can really map out your family tree, what's happening within the family, and can help more accurately articulate your risk for cancer, and if there's any need for any risk reduction strategies, heightened screening, which often there isn't necessarily, the potential for risk reduction medicines, or sometimes even genetic testing for some less common genetic mutations that can be present and increase the risk for breast cancer.
All right, thank you, Doctor. Very great information there. Now, another question that we all found interesting going through, it comes from Ariel, and this is for Dr. Goss. At what age range are women most likely to find out that they have breast cancer? I'm only in my 20s. Do I need to be screened? Dr. Goss.
Well, that's a great question. Breast cancer is an age-related cancer. It's not a cancer that women are particularly prone to get in their 20s unless they have a strong family history and in fact have been tested, as Dr. Lagari discussed, and there's been genetic counseling. So we don't generally recommend any screening with imaging for women in their 20s. Breast self-examination is something that's been examined and studied and is still unclear in its impact in screening. What we do clearly believe in and know is very valuable is screening women with mammography once they are 40. The 40 years old is a time to start annual mammography. We believe at Women and Infants that annual mammograms beginning at 40 and then lasting through adulthood and into a woman's 70s are a valuable part of routine examination. Other breast imaging studies are reserved for either diagnostic evaluation of something that's been found either by the patient or by a mammogram, and so aren't part of routine screening. So just to summarize, for the average woman without risk factors, routine mammography would begin at the age of 40 and would be annual.
So obviously very important to know whether or not any family members have had it, and make sure your relatives give you that information, right, Dr. Goss?
Absolutely, thank you.
All right, thank you. Our next question has to do with treatment, and she says, my doctor told me that my cancer was completely removed by my lumpectomy, but I'm scheduled to see, this is for Dr. DeRobertis, just so you know, and my doctor told me that my cancer was completely removed by my lumpectomy, but I'm scheduled to see a radiation oncologist. Why do I need radiation?
Well, that's a good question as well. Of course, I don't know the specifics of your case, but in general, radiation is considered an essential part of breast-conserving therapy. And the purpose of radiation is to kill any microscopic cancer cells that might be left behind after surgery, but are too small for any of our tests to detect. In general, radiation helps to prevent the cancer from recurring in your breast, helps you to preserve your breast and avoid a mastectomy, and can also contribute to your cure rates.
All right, thank you, Doctor. Great and interesting information. We also have a question now about post-surgery care, and this goes to Nancy Roberts. I have elected to have a bilateral mastectomy and was told I will need home care after the surgery. What can I expect for services, and is there anything I can do to prepare for my recovery? Nancy.
Well, every patient responds differently to surgery, and we know that, and you'll certainly be hearing about that this evening. So in terms of preparing, if you have decided to have an elective bilateral mastectomy, you've probably done a fair amount of research and have some understanding of what the procedure itself is going to consist of. Sometimes connecting with someone else, a neighbor or a friend, relative, or someone through your physician's office who's had the surgery can be very helpful in terms of giving you that firsthand sense of what you might have to anticipate. In terms of coming home and what you'll receive in terms of home care service, that's really individualized based on what your situation is, what your comfort level is, but what you can count on is that you would have a registered nurse available to you to be able to check your incision, your surgical site, help you with managing your symptoms post-op, and most importantly, being sure that you're comfortable and have answers to the questions that you most likely will have following the procedure.
Thank you, Nancy. And while we're on the topic of surgery, Dr. Goss, one woman also wanted to know what can be done to avoid feeling disfigured after surgery to remove a lump in her breast.
That's a great question. We have all sorts of different approaches to avoid the disfigurement that's been associated with surgery. If we think about the question we just answered, a woman who has a bilateral mastectomy, we're going to recruit the plastic surgeon to pair up with us during an operation like that to do a reconstruction after the surgery. And that reconstruction can be either with an implant, or it can be with the patient's own tissue that can be recruited from different parts of her body. In women who have chosen to do a breast conservation therapy, in other words, a lumpectomy and then postoperative radiation, in those patients, most women can be treated with simple surgery. However, there are times when the area of tissue that needs to be removed from the breast is either in a cosmetically sensitive area or is more extensive. And depending on the particulars of the tumor size and the patient's breast size, there are techniques that we call oncoplastic surgery that can let us reshape the breast during the operation so that when the surgery is complete, the contour of the breast is natural and the patient feels more comfortable with their appearance. Additionally, what we like to do in oncoplastic surgery is take into account any pre-existing breast disorders, might be the appropriate word. So if a woman's suffering from large breasts or breasts that have become somewhat, we use the word ptotic, but it means sagging, address both of those issues at the time of their breast operation, so that when the surgery is completed, the patient can look at herself and not feel scarred by her surgery.
All right, thank you so much. Great news for many women there, Kathy. Our next question is for Kathy Shilko, involving nutrition during treatment for breast cancer, which is very important. And this person is asking, my mother is undergoing treatment for breast cancer and has episodes of vomiting and diarrhea. What can we do to make sure that she stays hydrated at these difficult times?
Well, that's a great question. Nausea, vomiting, and diarrhea are very common side effects from cancer treatments. So dehydration can definitely be prevented by making sure that you get adequate fluids during this time. The best thing to do is, as soon as the vomiting episodes have subsided, is to start immediately by trying to take some clear liquids in very small amounts, even if it's just small ice chips, 2 ounces every couple of, 10 minutes, sipping on some clear fluids. And as those things are well tolerated, to keep advancing. The clear liquids can involve bouillon, broth, clear juices like apple juice, grape juice, apple juice, and as long as these things are tolerated, you can keep advancing and trying to get a little bit more fluids at very slow amounts. There are even some nutritional supplements that are considered clear liquids. If the vomiting and diarrhea has been for a long time, you might need some extra nutrition, and you can take those types of supplements at that time. Ginger ale is also used as a clear liquid. Sometimes you can stir it to get out the carbonation if the carbonation bothers you. Also Jell-O, popsicles are great sources also for clear liquids, especially if there's mouth sores involved, because those are very soothing. As soon as the clear liquids are tolerated, then you can move up to full liquids, milks, yogurts, custards, and you just keep advancing the diet as long as it's well tolerated. And this way you're getting the adequate nutrition as well as getting hydrated. So you just keep progressing the diet as long as you're tolerating that. Milkshakes are great because those are also soothing to the mouth and they can give you some extra nutrition. Also nutritional supplements like any of the Ensure or the Boost, as long as those are tolerated as well. And it's best to do it in very small amounts rather than trying to do 3 large meals. Try to do 5 to 6 small meals throughout the day, and that seems to be tolerated a little bit better.
We're going to keep you here, Kathy, because another viewer is asking, and this is interesting, how do I deal with taste changes during cancer treatment?
Changes in the sense of taste and smell happen because of cancer treatment, dental problems, or just the cancer itself. Although there's no way to prevent these problems, there's definitely things that you can do to help that until they subside. And when the treatment usually starts to get over, those feelings start to come back a little bit. So in the meantime, there's a lot of things that you can do to make it taste a little bit better or get away from the, sometimes there might be a metallic or a bitter taste. One of the most popular things is to eat with plastic utensils rather than with metal forks and spoons, to get away from that metallic taste, or use glassware instead of metal pots or things like that. Just different ways of seasoning foods is always helpful, depending upon what you're really trying. Sometimes just using different spices or different seasonings, marinating food ahead of time to give it a taste helps. Sometimes sweetening things with sugar or a sweetener, so it brings on that type of a flavor, helps. Or if you like the bitter taste, you can add lemon or different types of barbecue sauces to add that kind of flavor. Sometimes serving food at room temperature or cold helps to, decrease the taste or the smell rather than it being hot, and sometimes that can be helpful. Making sure that you have good mouth care, rinsing after each meal to get rid of that bitter taste is helpful, or sucking on like lemon drops or mints, chewing gum. It's really very individual based, so depending upon what you're really battling, sometimes it's difficult to pinpoint it, so you can try a number of different things to see what works best for you. Always seeing, maybe seeing a dentist also, the dental care sometimes can help. They can give you different mouthwashes also that might help.
All right, great information there. Very interesting. Dr. Fiore, I would imagine that depression also is another unfortunate side of breast cancer treatment, and one woman is asking if feeling sad or worried after being diagnosed with cancer is normal. How will I know if those feelings are something more serious like depression?
That too, it's an excellent question. Depression is very common in serious medical problems, and certainly with cancer. It's more common than it is in the general population, but still, this feeling depressed may just be a normal reaction, or it may represent a true psychiatric illness. It can be from the cancer itself, and it can be from the treatment itself. We really have to look at it and realize that some cancers are associated with a truly higher rate, such as cancers of the head and neck, pancreatic cancer, breast cancer, and lung cancer. But we have to look at each person specifically, because a lot of the symptoms of cancer overlap with the symptoms of depression. So cancer itself, as we've been talking about, can cause a loss of appetite, weight loss, fatigue, and certainly these symptoms of the cancer overlap with the symptoms of depression. So besides these physical symptoms, we really have to look at some of the psychological symptoms like social withdrawal, lack of pleasure, feelings of worthlessness and guilt, and of course, suicidal thoughts would be a very serious indicator of a serious depression. So I want to emphasize that while these feelings can be normal, in fact, many times they are normal, so I really want to emphasize, don't be ashamed to speak with your doctor, to speak with your nurse. Let them know that you're struggling with this kind of a battle, so that they can help you and guide you, and if necessary, they can even refer you for psychiatric consultation if necessary.
And this is really what this is all about, Care New England, all of the different aspects involved with treating breast cancer. And Dr. Fiore, if we could, that making perfect sense, another person would like to know if depression can be a side effect of the medications that they're on being used to treat cancer.
The simple answer is yes. Many medications can cause changes in our mood, and especially depression. Perhaps the most common one we think of are the corticosteroids. The steroids, like cortisol, can cause great fluctuations in mood and anxiety, and can cause hyperexcitable states of mania, as well as states of depression. We often think about interferon. Interferon can be very tough on the mood and can cause depression, and many people have been exposed to that. Sometimes the medicines may not only cause depression, but they can cause confusion, which can be mistaken for depression. Again, I want to give the same emphasis. Don't be ashamed by these symptoms of depression and anxiety and fearfulness, because even though these may be normal, may be caused by the medicines themselves, it doesn't mean they won't respond to treatment. So if you let your doctor and your nurse know you can get treatment for this, that can be quite beneficial.
All right, thank you, Dr. Fiore. So much expertise here. One woman also, and this is for Nancy Roberts, one woman would like to know how to find a home care agency experienced with caring for cancer patients. Nancy, can you answer that?
That's a very good question. When you're inviting someone in the home, you certainly want to know who that person is and where they come from. Many times your first source would be your physician, a recommendation from your physician of an agency, a home care agency they've worked for in the past. You may have had a family member who have had one. You also have access both to information on the health department website as well as the Medicare website around some of the quality indicators, how well an agency performs. I encourage anyone looking for home care to pick up the phone, call an agency, and just see how you're treated when you call that particular agency. Typically, you can ask for an intake department and ask them about the specialty and the competencies of the staff that they have. Many times, though, it is really that physician, that trusted medical advisor, or nurse at the bedside who may be making that recommendation. The other is just to verify that your own health insurance is in fact taken by that provider, because that's an important piece of just knowing what your coverage is and what your opportunity is to have full reimbursement for that service.
All right, thank you, Nancy. Now, Dr. DeRobertis, we've talked a lot about side effects. Many are caused by radiation, as we know. One woman says that she has heard that radiation is every day for 6 weeks, and she says she can't take that much time off from work, and she's wondering if there are any other alternatives.
But it is true that most patients who are treated with radiation for breast cancer do receive treatment over 6 weeks, and it's daily, Monday through Friday. There are some newer alternatives, such as hypofractionated radiation over 3 weeks or accelerated partial breast radiation over 1 week. Not all women are candidates for these treatments, so it's important to ask your doctor if you are. The other thing to be aware of is that most women who receive 6 weeks of radiation feel quite well during their treatment, and they experience minimal side effects. So many of them are able to work at least part-time during their treatment.
All right, thank you for that. Now, we're wrapping up some of the questions that were previously submitted on breast cancer, of course, for this webisode. And we thought we would end on a positive note. Dr. Legary, Michelle sent us a question after a recent scare, and she says, I had a very difficult scare result during a test recently, but thankfully everything came back negative. Does this make me more likely to have an issue with breast cancer in the future?
So, Michelle, my understanding of that question, just to make sure I have it right, is that you had a scare on some sort of imaging study. So that doesn't necessarily mean that you're at higher risk at all. I don't know the specifics of your particular situation, what the imaging test was. Was it a mammogram? Was it something else? But a lot of times, you know, for a mammogram, the radiologist may call you back for another image just to make sure it's complete, or if there was a area of ambiguity, just to get the right detail. And if that ends up being fine, then that's perfectly fine, and that really shouldn't increase your risk for breast cancer. There are exceptions to that, but that's typically the case. And a lot of times if someone gets a chest x-ray or another test, you know, certainly women having pap smears sometimes might have to go back sometimes for another test, but just having that quote, scare quote, doesn't necessarily increase your risk.
All right, thank you for that. Now we have some questions that were coming in live on our chat room, so we want to get to that. Dr. Goss, if you have a bilateral mastectomy, do you still need to get a mammogram?
Oh, that's a very good question, because I don't think it's controversial, but there seemed to be a lot of wonder about it. So bilateral mammography is for women with intact breasts. And what we're doing is we're screening the breast in a way with a technology that lets us find things in the breast that we can't feel. When we screen breasts with mammography, we're going to find cancers that are on average 1.5 to 2 centimeters. That's the data from our state in Rhode Island. So half of the cancers we find are under 15 millimeters, and that's something we can't feel. When we've done a bilateral mastectomy, I imagine we did a reconstruction, I can't, but in either scenario, that breast tissue is gone. That breast tissue that's hiding small lumps has been removed. And so we have absolutely no data to say that a mammography for that woman is of any value. So we don't recommend mammography after a complete mastectomy. Now that would not speak to somebody who had a procedure that is fairly well abandoned at this point, but maybe somebody's had a subtotal mastectomy where breast tissue was left on purpose, and it's so that person, if you do have leftover residual breast tissue, then that person might fall outside of what we're discussing right now. But MRI and mammography are not used for screening the breast tissue after mastectomy, even with reconstruction. There are a couple of studies looking at viability of implants used in reconstruction, where in that situation an MRI may be using to study the implant, but my understanding is that is even becoming less common.
All right, thank you, doctor. Also back to Dr. Legary, this one is probably a very common question. Are breast cancer patients more at risk for any other cancers?
Most women with breast cancer are not at increased risk for many other cancers. They are at increased risk for second primary breast cancer, is a little bit higher rate than the general population. So if someone's had one breast cancer, they're going to still be doing screening to try to make sure that, for instance, a different type of cancer doesn't evolve in another breast, in the other breast. So that's the typical scenario. And then in a small subset of women with breast cancer, maybe 5 or 7%, there can be a strong genetic predisposition for malignancy, say in somebody who has a BRCA1 or BRCA2 mutation. And those women could be at increased risk for breast and ovarian cancer principally, and then to a smaller extent, some other cancers. And then there are other rarer syndromes that most women don't fit into, where breast cancer can be part of a genetic predisposition to different cancers. But those are pretty rare. Those are pretty rare.
All right, thank you, doctor. And if we can have one more question your way, is there a way to prevent cancer from developing?
Yeah, that's the billion-dollar question. And,
Big one.
We are always just terribly humbled by our lack of understanding as to, what causes breast cancer. Going back to that other question, maybe 5 to 7% of the time, there's a very specific and strong genetic predisposition. But that's a pretty small amount. So that's saying, well, 93 or 95% of the time, that isn't present. And so what can we do about that? So we don't know about the specific initial events typically that lead to breast cancer. So we're learning about that, and there's a lot of research that's being done to try to understand that. Some of the things that I think are reasonable that we can tell people that fit honestly into the data that we have is that while we don't know the genesis of what causes most cancer, a woman could exercise, and some of these things sound very simple, but they might have true impact in terms of breast cancer risk. So exercise, limiting fat in the diet, limiting alcohol. We try to look at those epidemiologic risk factors. What are the risk factors? What can one do to decrease one's risk for developing breast cancer? And it's been difficult for us to find them in studies that we have. But we know that, starting at 1 drink a day and then increasing, there's a small but a rising relative risk for breast cancer, so that, modulating alcohol intake is something one can do. And there's a lot of things you'll read about, and we're still trying to understand. You might read about vitamin D and different vitamins and how do those impact breast cancer. And I think probably the truest statement is we're not entirely sure, and we're studying those things.
All right.
Could we just add
Yes.
that women with family history who've been evaluated and had that measured can consider stronger risk reduction therapy with tamoxifen.
Yeah. So if
Even if you're
somebody
not diagnosed, in other words, do you have a family history?
Right. So what Dr. Goss is alluding to would be there was a paper published in 1999, and then there were several subsequent papers with several medicines. One was tamoxifen, and then Avista, which is a medicine that's used for a bone mineral density in postmenopausal women. Then a third trial with an aromatase inhibitor, another medicine that we use to treat breast cancer, called aromasin. And those data sets, and thank you for bringing that up, suggest that if somebody has a higher risk of breast cancer based on their family history or benign breast pathology from prior biopsies, they might meet a risk level where there's data suggesting that these medicines, can decrease the risk for breast cancer, maybe by half, proportionally. So if one's risk was, 2% over 5 years, if one were taking one of these medicines, it would go down to about 1% over 5 years. So a fairly strong proportional benefit and a real but perhaps more modest absolute benefit.
And these questions, again, are coming in from our chat room live right now. Dr. Fiore, what is the most effective treatment, in your opinion, for depression in patients with cancer?
I'm not sure that the treatments are that different for people with cancer than they are for people without cancer, but there are some significant things to think about. Supportive therapy and guidance always, or almost always, would be indicated, and the medicines that we use typically to treat depression, they can cause some difficulties in people with cancer. They could exacerbate the problems with nausea and anorexia, especially in people who are already experiencing these problems. So there may be a role for some medicines such as Remeron that is not used quite as much in people who don't have cancer, with its ability to help people to relax and sleep and to stimulate the appetite. There may be a role for some of the medicines that have a very long half-life, like Prozac, so that if people have periods of time where they can't take PO meds, they won't drop their blood levels. And also the antidepressant meds, the SRIs and the SNRIs, have been used to treat the hot flashes that come with the menopause that can be induced by the medications and by the removal of the ovaries. And of course, in men who are getting prostate cancer treatment, they too can experience hot flashes, and the antidepressants can be helpful there too. It's fairly similar, though, to what we do for the treatment of depression in people who don't have cancer. There's interesting data about the group therapy that helping people. So this is even people who don't have severe depression, that the group therapy can really help people to feel better. So again, speak with your doctor and your nurse. Let them know you're experiencing these things, and that's the start to getting the treatment.
All right, thank you, doctor. This goes out to any member of the panel, if you just want to jump right in. What advice do you have for the caregivers? How can they lend support in these difficult times?
I might take that one, at least take it for a start. The caregivers are certainly not a forgotten group when you think about home health services. They are in the home, and that's something different than when you're visiting with your physician, where the caregiver may not, in fact, be there. Caregivers themselves need to take good care of themselves. They need to be mindful of their own health, their own well-being, and as Dr. Fiore mentioned, they also need support and guidance in terms of being able to cope with situations that are at times so much more demanding than they could have even anticipated. So their well-being, their own health status certainly needs to be addressed. And being able to use the nurse sometimes when they're in the home to help you think about how could you engage other family members? How do you help rotate some of the responsibilities across an extended family rather than only one single member of that family assuming the full responsibility?
All right, well, we so appreciate your time, all the great information, great questions coming from the audience, also live on our chat room here. We'd like to thank all of the expert panelists, again, for your time and obvious dedication to serving the women out there with breast cancer and their families, too, which is so very important.